Hi, I'm Takesha, and if you're turning 65 soon or helping a loved one with Medicare, this video is for you. Many people don't understand Medicare, which can lead to costly mistakes. Today, I'll break down parts A, B, C, and D, explain what's covered, what's not, and share tips to avoid confusion. Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing facilities after a hospital stay, hospice care, and some home health services. Most people don't pay a monthly premium for Part A if they've worked and paid Medicare taxes for at least 10 years. Part A does not cover long term care or custodial care, meaning if you need help with daily activities for months, Medicare won't pay. For instance, if your parent spends a month in a hospital, Part A helps. But if they need a nursing home stay for assisted living afterward, Part A won't cover it fully. Part B covers outpatient care, doctor visits, preventive services like flu shots, and durable medical equipment like wheelchairs. You pay a monthly premium, which can vary depending on your income. Many people misunderstand Part B. They think it pays everything, but you're still responsible for deductibles, coinsurance, and some services. That's why it's important to sign up for Part B on time to avoid late penalties. Even if you have employer coverage, it's important to understand the rules. Part C, or Medicare Advantage, is offered by private insurance companies. It combines Part A and Part B, and usually Part D for prescription drugs. Some plans offer extra benefits like dental, vision, or hearing coverage. It's important to know. Private plans may have network restrictions and require referrals for certain services. Always compare plans before enrolling. Part D helps pay for prescription drugs. Each plan has different formularies, meaning not every plan covers the same medications. Missing the enrollment window may result in penalties, so review your options carefully. People often think Medicare covers everything: long term care, dental, vision, or hearing. It doesn't. Other mistakes include signing up late for Part B, not comparing Medicare Advantage plans, and not understanding Part D formularies. Here's a major tip: keep track of deadlines and review plans every year. Medicare changes annually. Planning ahead is key. Make sure to review your current and future healthcare needs. Consider supplemental coverage like Medigap for unexpected costs. Use the official Medicare resources like Medicare.gov to compare plans and talk to licensed insurance brokers when needed. If this helped you, hit subscribe, like, and comment below. Remember, this video is educational and not affiliated with Medicare or CMS. Thanks for watching, and God bless.